head smashing, bones crushing, and family and fans cheering. Well, what is head smashing, bones crushing, and family and fans cheering your name? Athletes seem to be living the dream, being on big screens and getting rich. But what many do not talk about are the side effects of putting themselves in physical danger each game. Hello, my name is Marisol Zuniga, and today we are uncovering the truth about chronic traumatic encephalopathy, otherwise known as CTE. Well, what is CTE, you may ask? According to the Brain Injury Research Institute, CTE is a progressive disease in which the brain has caused problems due to repeated brain injuries and/or concussions. A concussion is a brain injury which can be caused by a jolt or a blow. Studies have proven that many football players experience degeneration of the brain, which then creates loss of function activity. Even post-injury, the brain still tries to self-repair itself by reorganizing the existing tissue or by the formation of new neurons known as neurogenesis. Unfortunately, severed neurons cannot repair themselves. When it was discovered, CTE was first described by Dr. Harry Smartland in 1928 by seeing the aftermath damages done on boxers. This was later proved by various other scientists. The reason I chose this topic is due to the curiosity I had in terms of how exactly physical injuries can cause internal issues that most of the times is long lasting. Symptoms can play a big part of one's health. Due to early symptoms, if caught early, could help one stop the progression of their physical or internal illnesses. As claimed by the Alzheimer's Association, symptoms include, but are not limited to, problems paying attention or concentration and headaches, which become considered stage 1, memory loss, the inability to remember past events, and personality changes like developing depression or bipolar disorder, which be considered as stage 2, erratic behavior, which we can be seen as stage 3, difficulty with balance, such as walking or standing still and feeling dizzy, and dementia can be seen as stage 4, and overall confusion can be seen as all the stages. So the sites that I looked up into provided me information such as Omalu was credited for the first discovering of the CTE in professional football players. The only way to definitely diagnose the disease was to examine the brain after death. The discovery was made in 2012 using an experimental brain scan, which showed a signature protein of CTE. Studies have also shown that CTE could possibly be genetic in terms of the testing they did on various cases. There's actually no treatment for CTE at the moment, and the best ways to avoid developing CTE would be to steer clear of any sort of injuries to the head. Even though there is no cure, many have symptoms of CTE, have caretakers in case they need any help or any assistance. This disease can actually begin or set within the first couple of months, or an injury can actually not develop or be seen until years or even possibly decades afterwards. As one can see below, the image shows the effects CTE has on the brain. The protein TAU is how CTE was found within the brain. The TAU actually forms into clumps, which actually kills the brain cells. Unfortunately, CTE is quite progressive and results in people who have it to averagely live to only about 50 years. According to the BU Research CTE Center, this disease can only be diagnosed upon the death of a person. MRIs and CT scans have yet to be able to diagnose those in fear of having it. Now that we have discussed CTE and what it is, we will go over what we have learned. First, we expose the truth of what the disease is and why I chose this topic. Then we unwrap the symptoms and the information I learned throughout my research over the disease. Lastly, we reveal the information over how it develops and how it is diagnosed. Although Although CTE is still yet not fully understood, one can see that scientists have made plenty of progress to help understand the components that affect those who have this condition. Thankfully, many research centers have been established worldwide to try to crack the case on this horrible disease and how one could diagnose it before death. Thank you so much for taking your time of the day to listen to my presentation. I hope you have a good rest of your day, and I would like to make a lighthearted joke to end on a good account. What do you call a school without a brain? A no-brainer. Have a good rest of your day.